So let's start at the beginning with a few words on ECG Basics. Most of your test questions on boards and clerkships will be on reading actual ECGs, so I will make this section concise to remind you about a few important concepts that you learned in your first year of physiology, and make sure that we're all on the same page. If you'd like a more in-depth, detailed description of the history of ECGs or of cellular electrophysiology, see Malcolm Thaler's book. So we're actually going to start at the tissue level and briefly review how changes in depolarization direction cause positive and negative deflections on the ECG. As we all know, depolarization is the electrical signal for contraction of muscle within the heart. We represent depolarization as a positive charge because the convention is to measure the changes inside the cell relative to the outside of the cell. From cell physiology, we remember that during depolarization, sodium and calcium rush into the cell and thus change the internal charge from about negative 70 millivolts to positive 20 millivolts. And so on this picture, we represent this change as a positive charge. An ECG uses electrodes to measure changes in charge over time. If we put a positive electrode on the right and a negative electrode on the left, then we have a direction that we're measuring in, the left to right axis. Next, if a wave of depolarization moves towards the positive electrode and away from the negative, this causes a positive deflection on the ECG. And the opposite is true too. If we have a wave of depolarization in the opposite direction, and then we have our same electrode configuration, now the positive charge is going away from the positive electrode, and now there's a negative deflection on the ECG. So here are two representations of the heart. On the left is a classic representation of the flow of blood through the four chambers of the heart. As you will recall, in the right heart, deoxygenated blood drains from the superior vena cava and the inferior vena cava into the right atrium. Likewise, on the left side of the heart, oxygenated blood drains from the pulmonary veins to the left atrium. Atrial blood then drains into the ventricles during ventricular diastole, or filling, and is aided by atrial contraction, stimulated by electrical depolarization originating from the sinoatrial node. On the right is a representation of the cardiac electrical conduction system. The blinking circle represents the sinoatrial node. What's interesting about the sinoatrial node is that it displays automaticity. It automatically depolarizes based on a special ion channel generating the funny current. The resulting wave of depolarization spreads across the atria like a ripple on a pond, and the muscular response is to contract and facilitate blood entering the ventricles. As the electrical impulse reaches the bottom of the atria at the mitral valve and tricuspid valve, normally these AV structures are electrically inert, except for the AV node, the electrical bridge from the atria to the ventricles. An important property of the AV node is decremental conduction. This means that the faster that the AV node receives input, the slower it responds. You can think of this as an electrical safety switch or a breaker. If you have an arrhythmia with too high of a frequency or rate, the AV node will drop some beats to preserve normal ventricular pumping rate. This delay also acts as sort of a switch timer to make sure that the ventricles have adequately filled with blood before systole, when the ventricles will empty. So after a brief layover of electrical conduction in the AV node, the electrical impulse then travels to the His-Purkinje system and then to the ventricular muscle where depolarization causes ventricular contraction. This results in deoxygenated blood in the right ventricle being pumped through the pulmonary artery to the lungs. Likewise, on the left, oxygenated blood is pumped from the left ventricle through the aortic valve to the aorta for distribution to the body. So finally, electrical repolarization in the atria and ventricles occurs in diastole, and this repolarization prepares the heart for the next electrical impulse. The most important point of this slide is that in the normal heart, there's an orderly progression of depolarization from the sinoatrial node through the atria, through the AV node, and then to the His-Purkinje system, and finally to the ventricles. And then after this depolarization occurs, then there's a diastolic resetting and repolarization of the heart. These events are easily seen and measured on the ECG, and these concepts are important for understanding cardiac function.